Hello, this is my SBAR for clinical day 7. I'm just going to get started. My name is Dana Vind. I'm the nurse on the med-surg floor caring for Yvette Ogam, a 34-year-old female, and I'm calling to give a report. The patient was brought to the emergency department last night by ambulance at 1800 for a heroin overdose. After the doctor was called and new orders were given, the client was able to state that her pain was manageable. Currently, the patient is emotional and showing signs of successful detoxification. She was stating that she wants to get better and help with her drug addiction in any way that she can in order to be there for her children and a better role model. The client has an allergy to aspirin, and her past medical history includes a back surgery in 2012, depression, and drug abuse. The client had 2 prior admissions for heroin overdose, and in the last 3 years she had been to rehab 3 times. Her family is a life stressor. She stated that she was going through a divorce with her husband and she had a strained, bad relationship with her 2 children. In the emergency department, Yvette was given 2 doses of 2 milligrams naloxone and vomited 2 times after that naloxone was given. She was then stabilized in the emergency department and transferred to the medical surgical floor in order to be monitored. Her pain was not being managed. During the night, she was being given ibuprofen 400 milligrams every 6 hours, and she was anxious. Because of the anxiety and pain, she wasn't able to get hardly any sleep, little to none, and she kept ringing her call bell every hour. Her COW score was a 14 at that time. And on the ibuprofen, she was just saying that she was in a lot of pain, 25 out of 10. There are labs pending for ETOH, a urine toxicology, CBC, CMP, magnesium, and phosphorus, but those results had not come in yet. There are track marks up and down her extremities, especially on her left forearm, so that should be monitored, but there were no signs of cellulitis or abscesses. The client is a hard stick and had a 22 gauge IV in her right forearm. On assessment, she was ANO ×3. The lung sounds were clear bilaterally. However, she was displaying withdrawal symptoms, which included tremors, severe diaphoresis, so much so to where we needed to change her gown, agitation, extreme anxiety, diarrhea, and she stated that she had vomited 3 times. Her COW score on this assessment was a 35. Her blood pressure was high, 150/85. Heart rate was high, 122. Respirations, 22. Temperature was 98.6 degrees Fahrenheit. Her oxygen was 100% on room air. With this assessment information, the provider was called and informed, and new orders were given. In this video, the orders weren't specified, but the nurse asked for a stronger pain medication and anti-anxiety medication, so I can assume that those were ordered. An hour after those new orders were implemented, the client's pain was manageable. She stated that she could manage the pain. Her anxiety was significantly reduced. She said that she finally felt cared for and acknowledged, and she was given comfort along with help from the nurse regarding her addiction. So the nurse counseled her on, on resources for her addiction, and just let her know that she was going to get the care that she needed. I recommend that the client be given more information on support groups, and like specific support groups for heroin use. And I also think that a consult from some sort of addiction liaison would be beneficial in providing accurate information on those resources for the client. The patient needs to have her pain monitored, so the orders that were implemented from the doctor seem to be working, so those should be continued. and I recommend that her cow's score be reevaluated in another hour just to make sure she's still on track with detoxifying safely. Okay, thank you so much.